Hi, welcome back to Christine's Health Affairs.
Hey guys, how you going?
We should rename it to Our Health Affairs or something.
No, but it's your
All
health.
right, it's about me.
It's all about Christine. It always has been.
In everyday life it is. We've been to the oncologist. It's been a couple of days since we've been to Melbourne and had some extra tests done and procedures. Seen the oncologist. But we had to come to terms with everything that we've learnt since then, and we also had to go to a big tournament yesterday.
Yeah, we had a table tennis tournament, which was a big day. We left here at 6:30 in the morning, 2 hours drive, hot conditions, played to the best of our ability all day, kept the bastards honest, so to speak, and got home by about 8 in the evening. So big day.
Turn this off.
We've got the fan on because it's a really warm night tonight, and it's even a little bit stormy outside.
And humid.
Yes. But anyway, we had a good time at the tournament. It was a bit of an escape from everything, which was great. And we've spent a day at work today, which we love, so that's another escape.
Long weekend this weekend in Victoria anyway, and it's been absolutely crazy in town today.
Very busy. It's amazing how uplifting it is when people give you money all day long. So I've had a good day in the shop. Things are going well. We've had a bit of time to absorb our all the information that was laid out to us from the oncologist, and there's a lot. I've still got to read through some stuff. But we've got a flurry of appointments, and a few people have mentioned that with the whole journey, everything happens so quickly at the start. You're bombarded with information. We've got appointments for an MRI and blood tests, and you got to get a port put in.
Yeah. Yep.
And then we've got to see the oncologist again. We're looking at starting chemo.
We can start from the beginning, I guess, from what we did on Thursday.
All right, let's go through what happened.
Yeah.
We met.
Do you remember?
No, Thursday was so long ago.
Then so much was packed into Thursday as well. So we went to the oncologist first, and we were really short for time because we had to get to the oncologist and then straight over to the ultrasound place so I could have a marker put in.
I think we reported there.
We did.
Yep.
And then the oncologist was fantastic. She knew that we were short of time, so she allowed us to go back and finish our appointment with her after we had been to the ultrasound place, had my mammogram and had the marker put in. And then we finished our discussion and picking up everything that she informed us about. But it was actually good having the appointment in two parts because we went through some major things about the drugs that I will be starting, and it gave us a little bit of time, even though it was only an hour or so. It gave us a little bit of time to have a quick chat about it and absorb
that's right.
information.
Yep.
And you know what she said with all of that. I'm not.
Well, we're still a little bit unsure, and she's a little bit unsure which is the best plan of attack immediately, and she wants to wait until we have the MRI because we'll get a much better idea of the size of the cancer. Because
the first ultrasound I had, the MRI said the cancer was about 1.6 centimetres.
Yeah, and then
the second one I had said it was just over 2 centimetres, but the surgeon felt the measurements should have been taken over a larger area, which meant it was even bigger. And when the oncologist felt it, she felt like it was about 3 centimetres. It actually feels a bit bigger than that to me.
But then it could have flared up a little bit
from the biopsy and having the marker put in as well. And so we're having an MRI, or I'm having an MRI this coming Friday. It's Sunday today, is it?
It's Sunday today, so that's our next appointment.
And I also have to have 2 blood tests. One is a genetic test to see if I've got any of if I have the breast cancer gene. And what's the other one for?
Oh, just general bloods, I think.
Okay.
Yeah.
And also because they also want to check the condition of my heart before I start chemo as well, because of the issue that I had a few years ago when I was incorrectly given penicillin, which caused me to go into anaphylaxis and have a heart attack and all that.
And that was another journey.
Yeah, that was a whole big saga. So because of that, I've got to have my heart checked before I can start the chemo.
Yep.
And then we talked about the port, whether or not I wanted to have a port put in, and whether it goes in the arm or in the chest. And a port, I think it's called a pick or a port. I'm not really sure. But it's an entry point for the chemo drugs to go into your body, because all the chemo that you've got to have destroys your veins. And to help preserve your veins, you have a pick line put in, and it's a little blistery thing that goes in under your chest with a tube that goes up to your neck vein. And that's how they administer the chemo drugs.
It's just better access for the drugs to get into your bloodstream rather than constant needles in veins. So
Friday we've got the MRI. The following Monday we have that thing put in. I have to go to a radiologist, I think, for that. And do I have to do something else?
No, I don't think. I think that's it. The next appointment after that is the Wednesday, which is when you start the chemo.
So when he puts that thing in on the Monday, he's actually going to leave that all set up so that they don't have to reattach things on the Wednesday. We've got our appointment is the very first appointment on Wednesday morning. We go in straight away, set everything up with our first meeting, and then chemo starts at 9 o'clock.
And then it'll be every Wednesday morning for 12 weeks. And it's not far from where we saw the oncologist, and it's about an hour and 15 minutes drive from here. So every Wednesday morning for the next 3 months. We're driving to Melbourne and coming back afterwards. The treatment, some weeks will be an hour and a half or so, some weeks will be about 3 hours.
I think the first one's 3 hours. And after we've done that course of 12 weeks, we have to do another 12 weeks of chemo, but it's every 3 weeks. And I also, after that is when I should be having my surgery, and we'll find out after that we'll have my surgery, I'll have my surgery, and then after that I'll be having radiation therapy.
But none of that is set in stone, because
But she did say that I'd still be having that.
Oh, she did. It looks like we don't avoid the radiation, which is a shame. But I guess the whole thing depends on how the tumour responds to the chemo. They're hoping it'll shrink it right back to next to nothing. But I don't think you can avoid the radiation from what they said.
No. And the blood test that I'm having to determine whether or not I've got the genetic gene or whatever it is will also probably determine whether or not I have a lumpectomy or a mastectomy. So if I have the genetic marker or that whatever it is, then it's likely I'll end up having a mastectomy in either one or both. I don't know.
But I think that's unlikely, and I think the genetic test is more a standard procedure. But given that your family has no history of cancer at all, it's unlikely. But we've got to jump through the hoops, don't we?
But then we didn't think I was going to get cancer either, so we never know.
So that's the practicalities of what we've got coming up. Obviously, we'll report to you guys as we go. The hair loss may happen fairly quickly. We're not too sure. It seems everyone's different.
We were told that the first course of chemo, I will probably have some hair coming out, or I'm likely to have hair coming out, and it might be patchy. And I don't want patchy hair or a patchy head. I want
it's
my hair...
It's patchy on the inside.
That's my hair. That's my brain. I want to have a full head of hair, or I'm going no hair. And look, I'm actually really looking forward to this. And Chris and I were talking about this today, weren't we?
I proposed the scenario that suddenly we get an email to say, hey, look, with your particular test results, it seems that weirdly you won't lose a single strand of hair. And I said to Christine, how would you react to that? And she actually said she'd be disappointed.
I would be, because...
So if that doesn't say you've come to terms with it, nothing does. So.
It's still going to be a real shock to see myself with no hair. I'm practising putting things on my head wraps or something.
She looks pretty cute.
I think so too. So I have been practicing with that just to get myself used to it, also to get Chris used to it as well, because we're the ones that are going to see me all the time, and just generally getting used to it.
But we did talk about the fact that a lot of the times you have your hair up
Yeah, I know. It's
and tied up at
always
the top.
back.
And because it's back, it actually, if you put a wrap on your head now,
It wouldn't be much difference.
No,
No,
so, yeah.
no. So, and I think Chris would be really happy about the shower as well because
I won't have to clean out the drain as much. Or maybe a lot for a start.
Well, no, because I'll shave it.
Well, yeah.
So I think that I'm going to wait for my first round of chemo, maybe give it a couple of days because I've been reading some things and you guys have been fantastic giving me lots of advice, sharing your own journey as well. And some people have said that their hair goes really brittle or it just feels really horrible and you kind of know when it's time to get rid of your hair. So I might just see how it goes for a few days after chemo, which is Wednesday week.
Yes, yes. So about 10 days or so. Yep.
So we got some mail on another note and we're going to open it up together. Because it was addressed to Chris and Christine. Well, actually, it was addressed to Chris and Chris. So I'm figuring it's about our journey, not to do with my sewing channel, because it wouldn't be sent to you, would it? But I like that this was sent to Chris and Chris at Stitch This, because the post office knows who we are. So if you just put Chris and Chris, it's going to get to us.
It will, pretty much, yeah.
But people have asked if I have a mailing address. I did put it in the About section of the channel, so there is a mailing address there if you want to send a card.
So there's something in it other than a note.
Yeah, there's something soft in there. And this is from somebody called Judy, who is in Victoria, which is our state. It's a nice little card. Oh, we get 2 hearts.
Well, show them.
Well, can I read it? Okay.
1,000 hearts, it
1,000 hearts, global kindness community. This pocket heart has been lovingly handmade as part of 1,000 hearts to share and celebrate kindness. And here come the waterworks. Because I'm just a sook. Keep it close and give it a squeeze when you need a reminder of love, hope, courage and comfort.
Isn't that nice? This one was upside down there. That's the right way up. There we go.
I hate when people are nice to me.
Oh, so there's quite a long letter.
Okay.
All right. Do you want to pause and we'll be back shortly?
No, you can read it.
I'm not going to read it out.
You can have a sook.
It might be personal.
Well, if it's personal, we'll edit it.
Well, you can read it.
Dear Chris and Chris, enclosed, please find a small gift.
No. Maybe we'll read it and we'll
I'm going to cry
it.
whether
We'll summarise it next episode.
That's all right. I'll get through it. I have been part of 1,000 Hearts for some years now and have witnessed the power that these little handmade hearts have had in giving people comfort when times are tough. Are you going to cry with me?
No.
You will. Quite a few years ago, my husband and I visited your fabulous store. And you both were very helpful when I started asking questions regarding starting my own online handmade products business. From that point, I started watching Christine's Home Affairs and have admired your generosity yet again with giving freely of your expertise. You have been dealt a tough gig, but if these little hearts give either of you a little bit of support, please know they have been sent loaded full of love and support to you both. If you have anyone else who may benefit from a heart in their pocket, don't hesitate to call and I will post some more. Best wishes, Judy. I actually think I remember having a conversation with Judy about this in the shop.
That's very sweet.
About the business side of things. Yeah, that's really beautiful, Judy. Thank you very much for making me cry.
A follower.
Thanks, Judy.
Yeah,
that's lovely.
Much,
that's
Judy.
Really nice.
We'll pin those up or something. What are you supposed to do with them? Put them in your pocket?
Hug them and squeeze them.
Okay. I'll read the fine print later.
How are you feeling?
I'm always very practical. I can't help it. It's just, you just knuckle down and do things because you have to. I got to admit, the comments I'm reading from you guys do bring a tear to my eye, don't they?
They have been,
We have trouble dealing with people when they're nice.
Especially me.
But no, we certainly appreciate all the support, and we'll just keep going one day at a time, and we'll share it with you guys.
And that's all we can do.
Yep.
Even though we've been quite chirpy over the last couple of videos, and we mostly are, or I know we are. We're nearly chirpy all of the time. The only time I'm not is usually when I'm on my own.
Yeah.
And thankfully that doesn't happen very often. But usually, and I don't know if you know this, but every night when I go and have my shower, I just end up bawling my eyes out.
It's a natural coping mechanism, and there's nothing wrong with it.
Yeah.
In fact, you'd be more concerned if you didn't cry. So, yeah.
So I did say this was going to be warts and all.
And we had some fantastic support from all our table tennis friends on
And
Saturday.
these are my warts. We did, yeah.
And there's been a lot of people there who've been on a similar journey.
They've been great.
Were a great support. So.
And yeah, thankfully I didn't get too many pity hugs. It was just a lot of great support because going through this, you actually don't want somebody coming up and saying, "Oh, you poor thing, Christine," and give you a hug and feel sorry for you. It makes you feel worse.
Yep.
So, yeah, come and shake me or do something silly.
Look, I'm sorry to hear it.
Yeah.
And let's go and have a game and see if you can beat me.
Yeah. So, I think that's about it.
I think that's it for tonight. We've probably talked for a long time. I can't see the timer on the screen. But, yeah, we won't have anything much to report really until, well, the MRI is Friday.
Yep.
But, yeah, we'll keep you in the loop.
Yeah, and so we won't know anything really until Monday. The oncologist will let me know the results of the MRI and the blood tests. Mm-hmm. So, yeah, it'll be about a week of no drama, no driving. That should be nice.
That's true.
Catch up on some of our other videos.
All right. Well, do we have a sign-off?
Not yet.
All right.
See ya.
Bye.